it's an exciting time, right? And I'll start with that first. It's an exciting time for what I call the neglected patients. And what I mean by that is the patients that couldn't tolerate PAP therapy and they tried and just stopped showing up, and they were not to be seen again because they didn't think that any of us had any other alternative options for them. And when I started implementing Inspire in 2019, the number of patients that I saw come back that I hadn't seen in 8, 10 years, I was like, oh man, great to see you again. Like, what happened? Like, I tried and tried and tried, doctor, and I just couldn't do it. And I didn't really think that there were any other viable options that you could offer me. So I didn't want to come waste your time. And that was the honest truth. But so how have you been feeling? Like, I'm still sleeping poorly. I'm still snoring, and I'm still sleeping in a separate bedroom. I'm still tired. Right. So from that standpoint, and that's a story I think all of us in sleep medicine hear over and over and over again. So first off, having alternative therapies in this space of hypoglossal nerve stimulation therapy is great for patients, right? It's giving us as a field the opportunity to show our patients that, hey, we're not only focused on the new diagnosis, we also now can shift part of our focus on the patients that were previously diagnosed that are not using therapy because they couldn't tolerate PAP therapy, but they're suffering consequences both from a subjective and objective standpoint because of their untreated moderate severe OSA. So from that standpoint, like, I'm all for alternative therapies. But when I make a decision, like with anything, right, I'm going to look at the trial data with a fine tune, with a kind of a close lens in terms of what did the studies show, like what was the attrition, what was the adherence? Because adherence in this space is extremely important. I mean, adherence with CPAP therapy, we know, is, over 3 years is less than 50%, probably less than that even if you get into the weeds. So if a patient is not using any therapy, no matter how effective it is, it's not an effective therapy, right? And us calling CPAP a gold standard is a problem, because how can a therapy be considered a gold standard if more than half the patients over time stop using it, right? It's not, you can't call it a gold standard. But getting back to your question, for me, when looking at any clinical study, I'm going to look at the attrition, how many patients actually dropped out, right? With the STAR trial, the attrition was very low. I believe it was less than 2%. With the DREAM study, the attrition was about 23%. Then serious adverse events related to the procedure or the device. In the STAR trial, that SAE was less than 2%. In the DREAM study, I believe it was probably closer to about 7 to 8%. And then adherence is also important as well. Like, how well do the patients use therapy? Because it doesn't matter how beautiful the therapy is and how effective it is at improving AHI. If they're not using it, then that's a concern for me as a clinician, because at the end of the day, I want to make sure that I'm collectively making a decision with my patient for a treatment option that I know that there's a high likelihood that he or she is going to be able to use it, right? Because with any surgical therapy, like, the last thing any of us, I think, would want as physicians is to say, hey, we're going to send you down this pathway of getting a surgical implant that I'm skeptic partly of whether or not you're going to be able to use it successfully. And it's important to have a full disclosure discussion with the patient in terms of what's involved in using it, right? A lot of patients, just don't fully understand, even when it comes to CPAP therapy. I've had patients come in saying, I didn't realize I had to change the filter every 2 weeks, and I didn't realize I had to put distilled water. I didn't realize to wash the container every day, and yada, yada, yada. And that in turn results in patients saying, well, I'm not going to do this. And I'm a CPAP user, and I get it. Like, I understand the nuances of having to do this every day. But those are the important things. And with regards to adherence, the STAR trial adherence greater than 5 nights per week was roughly around 91%. And the DREAM study was about 52%. Yeah, well, but I'll give you an actual real life example from my practice. We had a patient who could not tolerate PAP therapy, had a BMI of about 36, had a baseline PSG AHI in the low 90s. He was referred to ENT. This is just a year ago. He was referred to ENT, had a drug-induced sleep endoscopy to evaluate for Inspire. He did have complete concentric airway collapse, so he was immediately disqualified. He was then placed on, I believe at the time it was probably semaglutide, because tirzepatide wasn't FDA approved for the OSA indication. But he lost, and he was symptomatic. He had daytime hypersomnolence, poor quality sleep, snoring. He ended up losing a significant amount of weight to where his BMI did drop down to about 32. But because he was still symptomatic, he was reevaluated in the sleep lab. His AHI reduced from the low 90s down to by at least 50%, but he was still symptomatic. So he was referred back to ENT to do a new drug-induced sleep endoscopy. His triple C was completely resolved, and he was implanted with Inspire, and he's doing extremely well. So, and his AHI, improved dramatically to less than 10, and he's asymptomatic. So, that's another thing to keep in mind as well, is that there's ways to think outside the box on a patient, like we did in that gentleman's case of, all right, you've got a high BMI, you've got triple C, you're symptomatic, you've got very severe OSA. We know that there's a higher likelihood that if you lose weight, the triple C can potentially resolve, and there's likely going to be improvement in your AHI. So let's address that first. Let's see how you do. If you're still symptomatic, you still have moderate severe OSA, then let's try again. And it was a good outcome.